Hi, everybody. This is Greg Olsen. I'm the director of the New York State Office for Aging. Thanks for joining us today. And before I formally introduce my guest from the State Department of Health, Dr. Heather Dacus, I first want to thank Alex Hyatt, Kelly Matija, and Nancy Graham, part of my communications team that make these, all the behind the scenes effort to make these programs run smoothly. So I want to thank them. In 1999, the Prevent Cancer Foundation led the charge to designate March as National Colorectal Cancer Awareness Month. To achieve the designation, the foundation worked closely with legislators, the American Digestive Health Foundation, and the National Colorectal Cancer Roundtable. The designation became official on November 19, 1999, with a declaration by the U.S. Senate, followed shortly thereafter by a resolution of the House of Representatives and an official proclamation by the White House. While colorectal cancer affects both men and women in almost equal numbers and is the second leading cause of cancer death in the United States, second leading cause, there are several screening methods available, making the disease highly preventable. So March is Colorectal Cancer Month Awareness Month, and I could not be more pleased to formally introduce my colleague, Dr. Heather Dacus. And let me tell you a little bit about Heather. Dr. Dacus joined the New York State Department of Health in 2007 and serves as director of the Bureau of Cancer Prevention and Control. A board-certified New York State licensed preventive medicine physician, she earned her master's in public health degree at the University of Albany School of Public Health and her medical degree, excuse me, from the Philadelphia College of Osteopathic Medicine. Prior to joining the health department, Dr. Dacus spent 6 years as a medical officer in the U.S. Navy, providing direct medical care to sailors and Marines in Washington, D.C., Okinawa, Japan, and upstate New York. And that's quite a robust background. So Dr. Dacus, I'm so happy that you're here with us today. You know, people are always dealing with a lot of things that stress them out. There's a lot of demands on people's time and energy and where to focus those things. That was true prior to COVID, but obviously COVID has made the last year really difficult for a lot of people in a lot of different areas. I'm so pleased you're able to join us today because this is such an important topic. And you really are the expert here in New York on this issue in your capacity. So can you tell folks that are listening today live or will be in the coming weeks what colorectal cancer is?
Yeah, absolutely. And first, let me just say thank you so much for having me. What you all are doing here across your network of partners and all the caregivers around the state is really important. And I am so thrilled that you're highlighting such an important topic. And I also want to just thank my staff too, who helped prepare me. You know, we always have folks in the background that are helping us do the good work that we do. So I cannot take credit for, everything, but really happy to be here. So yeah, I mean, when we think about cancer, there's so many different kinds of cancer, right? For every part of the body, it seems there's a different type of cancer to talk about. So when we talk about colorectal cancer, we're talking about cancer that occurs in our large intestine. So the colon and then the rectum, and these are parts of the body that we don't often like to talk about because of the bodily functions that they produce. But colorectal cancer, as you said, is an important cancer to talk about and for us to be aware of. Cancer in the colon or the rectum can often start as just some cells that get a little unchecked and grow abnormally, and you'll hear the word polyp said. So a polyp is like a growth of cells in the lining of the colon or the rectum. And while those can be pretty common, sometimes they can become aggressive and turn into cancer. So, when we talk about colorectal cancer, we're talking about trying to get in there and find polyps so they can be removed and prevent cancer from occurring in the first place, or just find it early. So, yeah.
So what do you find, if anything, is there something that increases a person's risk for this type of cancer?
Yeah, whenever we talk about risk factors for cancer, it's important to think about it in two different ways. There are the kinds of risk factors that we just can't do anything about. And then there's the risk factors that maybe we have some control over, right? So if you think about how old we are, none of us can halt our aging process. So we know that age is a risk factor for most cancers, including colorectal. So as we age, we see that colorectal cancer occurs more often. We'll talk about that more a little bit later. And then there are the genes that we inherit from our families, right? So if you have a family history of colorectal cancer in your sibling or your parent or grandparent on either side of your family, that would increase your risk for you also getting colorectal cancer. There are actually some inherited conditions, Lynch syndrome and familial adenomatous polyposis, which is a fancy name for, a genetic condition that there are some people that will inherit those genes. And then there can also be things like inflammatory bowel disease. So I think a lot of people are probably familiar with the terms Crohn's disease or ulcerative colitis. People who have those kinds of inflammatory bowel diseases, they can be at increased risk for colorectal cancer. So those are factors that you can't always do a lot about. And then we talk about things that you can maybe have some influence. So things like how much weight we're carrying on our bodies, right? There is some evidence that being overweight increases our risk for getting colorectal cancer. Then there's also being physically active. In general, everybody would recommend that we be more physically active than we typically are, and we do see that colorectal cancer happens a little more frequently in people who are less physically active. How much we drink alcohol. So colorectal cancer is actually found more commonly in people who heavily drink. Smoking, no surprise, we know smoking is a risk factor for a lot of cancers, including colorectal cancer. And then the foods that we eat. So if we have diets that are high in red meats or processed meats like bacon and, or over-the-counter type lunch meats, if you will, a diet high in those things and diets low in vegetables and whole grains can increase our risk. So there's a lot of factors at play for colorectal cancer.
Right. So there's those things we really can't control, but there's things that we can. And I think one of the things that we work so well with, your agency and many other agencies and the prevention agenda, health across all policies, age-friendly communities, really targets those types of things. Staying active, if you stay active, that helps control your weight. Smoking cessation, not drinking alcohol, eating good foods, trying to increase access to good and healthy foods. It's one thing if you are screened, and hopefully people will get screened, and I know that's a major part of what you're going to talk about today, and we want you to talk about, to identify. But our big effort, your big effort, and a lot of what the health department does is prevention, because we want to get to a point where we're not dealing at the back end. We want to stop these things from the front end. So can this type of cancer be prevented?
Yeah, I think when we talk about cancer prevention, it's kind of the sticky place to be, because like I just said, there's all these different risk factors, and sometimes they can affect whether or not you get cancer. I was diagnosed with thyroid cancer in 2006, and what were my risk factors for thyroid cancer? Could it have been prevented? I sometimes still even think about those things now, but when it comes to cancer prevention, we can all just do our best, right? And I think with colorectal cancer, a huge message is that we try to live healthier lives. Absolutely. We talk to our families about our family history. And if we do have a family history of cancer, we should talk about that with our healthcare providers, because maybe you need to be doing something sooner than other people. But when it comes in general, I think colorectal cancer screening is probably one of the best tools that we have to kind of level the playing field, if you will. So, getting in there and, doing, like you mentioned earlier, there's lots of options, and we'll get into those for doing the tests. So cancer screening aims to, in colorectal cancer, either find those polyps, take them out, so we never have the colorectal cancer develop in the first place, prevention. And then there's finding the cancer early. And we know that if you find colorectal cancer early, the chances of long-term survival are quite high, like 90% survival rates when cancer is found early. So yes, it can be prevented. Is anything ever a guarantee? Absolutely not. But I think we can all, get to a place where the risk is lessened as much as possible.
Yeah, and we're going to get to those screenings because, when you talk about like survivability rates, that's the point. Like
Right.
this will kill you if you don't take some steps to get basic screenings. And as I opened up with, it's a second leading cause of death among cancer. So
Yeah.
this is serious. Now I'm a big fan of numbers because numbers speak. I could go home tonight and think, this isn't for me. It's not going to happen to me. But numbers speak a different word. So tell me about how common this is in New York State.
Yeah. Yeah. I think that you're right. So let's put this. So every year, about 35,000 people are diagnosed with cancer in New York State. 9,000 of those are colorectal cancer. Every year, 9,000 people are diagnosed with colorectal cancer. And about 3,000 people a year die from colorectal cancer. So we're talking about a high burden cancer. And, thankfully, there's been a lot of improvements in the treatment for colorectal cancer over the decades. Obviously, screening has been a big benefit, but it's still the second leading cause of cancer deaths after lung cancer. So.
Now, are you seeing from the work that you do and the numbers, because the data is really important, and that's a major part of obviously what you guys do is track this stuff. You need to know where it is, et cetera. Are you finding that it's increasing over time, the rates of getting colorectal cancer, and are the deaths increasing?
So, I mean, you mentioned at the top of our conversation about the declarations that were made in the late 90s, and there's been a lot learned over the X number of decades. So the good news is that in general, the trends for new colorectal cancer cases and deaths from colorectal cancer are on the decline, and have been for the last 2 decades. I think we're seeing a slight bit of a leveling off of those decreases, which really coincides a lot with the leveling off of our screening rates. But, because of improvements in treatment and because of how aggressive screening has been in the last 2 decades, we went, I think, from in 2000, the screening rate was maybe 20% of the population getting screened to 70% now, right? So that's a huge difference, and that would definitely explain the downward trends. But we're leveling off a bit, which means, we need to keep pushing towards our statewide goal of 80% screened for colorectal cancer. Now, the other thing that's happening, and there's been a lot of coverage about this, and there should be, is when we see the trends going down, that is overall, and that is in populations 50 and older. Over the last few decades, the statisticians have really brought to awareness now that there's a slight increase in trends in people younger than 50. So colorectal cancer can happen to people at any age, any race, any ethnicity, men and women, right? All genders. It is much more common in people over 50, but it is happening in people younger than 50. And so it's important to acknowledge that for lots of different reasons that I know we'll get into.
Yeah, and I think you're right. You see the same thing in things like Alzheimer's, early onset Alzheimer's disease. People don't attribute it to a younger age, and there's probably a variety of reasons for that. Younger people eat worse than they did. Many are much overweight, and those were some of the risk factors.
Right.
COVID brought out some terms that I was aware of, and you were aware of prior to, but maybe the general public wasn't. That's health disparities.
Mm-hmm,
So let's talk about, in the context of this, are there groups of people who are more diagnosed, less diagnosed? Do certain groups die more or less? And I have a feeling I know the answer to this, but I'd love to hear what you think.
Yeah, so I want to just say up front, because I think it's a really important message, that people of all genders and races and ethnic groups can get colorectal cancer. I don't think any of us should feel safe, if you will. I don't love that word, but you know what I mean. We're all at risk, and so we all should be talking to our healthcare providers about this cancer, as well as some others. But yes, absolutely. While we're seeing the trends come down overall, and the trends of new cases and deaths coming down across all races and ethnicities, we still see more African Americans diagnosed with colorectal cancer, and with slightly higher rates of death due to colorectal cancer. And it doesn't it isn't felt to be, a genetic cause. A lot of the disparities really are complicated by a number of things. The prevalence of risk factors, which have their own causes, access to health care. A lot of times when we talk about screening, we forget that not only do we screen for the cancer, but if that screening test has an abnormality on it, it's really critical that that gets followed up on to actually see if it's cancer or not, right?
Yeah.
So if I take a stool test at home for colorectal cancer and it comes back abnormal, really quickly, I should go for a colonoscopy. So some of these racial and ethnic disparities that we're seeing are access to care, access to timely care, right? Or are people getting into the follow-up diagnostic testing quickly compared to other groups? And then, just socioeconomic status and systemic racism, right? Frankly, right? I think that's huge here at play, and I'm happy that we are more talking about that now than maybe we were before. But yeah, these are absolutely factors that are at play here and need to be addressed.
Yeah, and I mean, you talk about access. So when I turned 50 a couple of years ago, that was the first thing that my primary care physician actually reached out to have the screening. But let's say that I'm in the 30% that don't get screened. If I have a knee injury, I'm going to feel that knee. When I needed neck fusion, I felt it down my arm. Are there any, if I'm in that group that hasn't really thought much about this or don't have the access or might not have a primary care physician, et cetera, are there symptoms that are fairly common that would indicate that, this might be this?
Yeah, I'm glad we're talking about this. I think symptoms for colorectal cancer are really important to bring to light. A lot of times, I have a really close friend who went to her doctor when she was 35 years old and said, "I'm having bleeding from my rectum." And I'm so thankful that her doctor took that symptom seriously, because she was diagnosed with colorectal cancer, stage 3, at the age of 35. So colorectal cancer doesn't typically cause symptoms in the early stages, which is why, for the most part, most of us, screening is what's needed. But when colorectal cancer is occurring in our bodies, it can cause changes in our bowel habits. It can cause bleeding from the rectum, or even stools that look really black, which would be different than normal. Unexplained weight loss, changes in our appetite, things like that. So, we don't typically go to the doctor until there are problems. I wish that we endorsed more of an annual checkup kind of approach in our society. But short of that, I do think we should be talking and asking our patients about their symptoms of colorectal cancer and acting on those quickly, regardless of anybody's age, because it could be the first time it's, showing up, and needs to be acted on quickly.
Right. So let's now talk about screening. So
Yeah.
again, my experience was 50 years old. I got to be honest with you, I'm not sure when the next one is. 52 now, but why don't you tell us, when should somebody get screened as a general advice?
Okay. So if you are somebody who has a family history of colorectal cancer, or yourself had a history of colorectal cancer or polyps in the past, or you're somebody who has Crohn's disease or ulcerative colitis, you should go talk to your healthcare provider now and ask when screening for colorectal cancer should begin, because it could begin as early as in your 20s or 30s, right? Or maybe the 40s. But you're going to start on a different track than those of us that are more likely to be at average risk, if you will, for colorectal cancer. And so adults who are at average risk, recommended to start colorectal cancer screening. Right now, the main recommendation is at age 50. We're really on the cusp of that changing to age 45. There's a national organization, United States Preventive Services Task Force, which is released a draft recommendation statement that screening should start at 45. The American Cancer Society recommends screening start at age 45. So, I think those messages are probably going to be aligned, but no later than age 50, people should be screened for colorectal cancer. Absolutely.
Okay. Now when we were kind of prepping for this, I was talking about the colorectal screening test.
Yeah.
And you said, no, it's tests with an S on the end. So
Right.
I didn't realize there was more than one. What are they, and is one more preferable than the other?
Okay. So I think it's good news that there's more than one way to test for colorectal cancer. The big one that everybody's aware of is the colonoscopy. An excellent test. It's direct to visualization. You as the patient take some prep liquids the day before, the night before, so that your colon and your rectum gets cleaned out. You go get the colonoscopy, and a lighted tube is inserted. Most patients are typically sedated, not all the time, but most of the time. And the doctor looks for polyps or cancer. And if they see polyps, they remove them or they take biopsies. So that's a colonoscopy. If nothing is ever seen on that, like in your case, if it came back normal, then the recommendation would be that you get that done every 10 years. If something was found, the doctor might recommend it be done, more soon than that. But a lot of people don't want to go for the colonoscopy for lots of reasons. It's a day off from work. It's maybe not anywhere close by. You might just be like, I don't want that up my backside. I'm not going to get it done if that's my only choice. People like options, and we have actually seen in research that more people will be screened for colorectal cancer if they are offered options. So the other big option are take-home tests based on your stool. And there are different kinds. The big one that we promote is the fecal immunochemical test. It's a 1 or 2 sample test that you do in the privacy of your own home. You don't have to have any dietary restrictions beforehand. And if that test comes back abnormal, then you would go for that colonoscopy, right? So it's kind of like, only if this is a problem would you go for this other test. That has to be done every year, right? So that's not, people don't always like that option, but it's an excellent, safe, effective option. The other big stool test that people is newer on the market is what's called a stool DNA test. And that can be done every 3 years. And that's growing in popularity. But so there's these options, and talk to your doctor about them. Do one of them, get it done, because this is about saving lives and improving survival.
Yeah, and I think that's important because on the colonoscopy one, I can express my experience. I didn't feel anything. I was sedated. I was more embarrassed that they were working down there, but then they said, you know what, we do this every day, don't worry. And so that put me at ease, but it was okay. But I think your point isn't one's better than the other. You have to do something. And at least the other 2 options are in the privacy of your own home. They're done by mail. And do something, don't do nothing, because doing nothing, you could wind up one of the 3,000 people that die every year. Of colorectal cancer. So, you mentioned earlier, and I think these were New York State numbers, that we're at 70%. You want to get to 80. I'd love to see 100, but we can be dreamers.
Right.
And you talked a little bit about the barriers. Is there anything that you wanted to add on those two things that you had mentioned previously?
Yeah, it's so interesting. It's like that 70%. We've been hovering around there for a number of years now, and in as much progress that's been made, it's like we can't push up. But despite a lot of people's efforts, men are less likely to be screened, and so working on all genders getting screened is really important message. People have men in their lives, people that are viewing this right now, making that recommendation to the men in their lives to talk to their doctors. And then even 50 to 60, we see more people getting screened for colorectal cancer in their 60s and older. Just getting more people screened in that 50 to 60 window would be a huge benefit. And then, of course, backing it up to 45, is where we're looking to be going. People who don't have health insurance are less likely to be screened. If they don't have a regular healthcare provider, they're less likely to be screened. So hooking people into the medical care system is huge. And obviously COVID's had a big impact on that. So pushing efforts out to get people to feel like it's safe to go back is going to be really important.
Yeah, not to digress, but you hit a really important point. I mean, the effort to expand health insurance, we've done a great job in New York State, the country, not so much. But let's say somebody doesn't have access to health insurance and doesn't see their PCP regularly. I think the most affordable would be the 2 take-home tests. What would do you have any idea what something like that would cost if I did that on my own?
Oh, that's interesting.
I don't mean to throw you a curveball. I just was
Yeah.
thinking about that.
Well, I mean, I think there actually are some over-the-counter tests, but I don't know that I would recommend that,
Okay.
if you will. But we have a really amazing program in our state called the New York State Cancer Services Program. It's been around since the 90s, and at least the last 15 years, that program has covered colorectal cancer screening in uninsured people. So, and not only is it for the screening test, but it's for any diagnostic testing needed afterwards. And we also can hook eligible people up into the Medicaid cancer treatment program if they're diagnosed with colorectal cancer.
Okay.
So, and then it's not just the cancer treatment care that they would get, it's their full coverage of Medicaid.
Can you repeat that? And Alex, can you put that resource into the chat box, please? Can you repeat the name of that program?
Yep, the New York State Cancer Services Program, and the website that is being shared. People can call 1-866-442-CANCER, 1-866-442-CANCER, and they can actually be directly connected to the Cancer Services Program in their county or borough. This is a statewide program, and we know people have lost health insurance through the pandemic, so there's an even greater need than there was before. And people can be set up to get screened for colorectal cancer.
Great. Well, thank you for that resource. And that's a perfect segue. So I'm assuming that the numbers you gave were before March of 2020.
Right.
When you have a Matilda's Law stay-at-home order trying to stop the spread, obviously access to in-person anything became very, very difficult over the last year. So what have you seen in terms of the pandemic and how that's impacted screening?
Yeah, it's had an impact nationally. Lots of our colleague organizations have looked at this, and I think the current estimate says something around 35% of Americans that were due for some kind of cancer screening didn't get it during the pandemic, and there's a lot of good reasons, right, that we didn't go out to do this kind of test. But we also saw delays in the treatment of some cancers during that time period. So now we're kind of backlogged on the screening end. So it's a bit worrisome, right? That now when we do find colorectal cancer, it maybe we're going to be finding it at a stage that we would have hoped to have seen it sooner. But I think the big message right now is that it's safe. Doctors' offices, hospitals, medical systems, they have the right procedures in place for people to feel comfortable going back and getting caught up on all of their preventive care, not just colorectal cancer screening.
Yeah, and that's super important for everybody, not only listening, but to any of your loved ones, that getting back on track is really important.
Yep.
So, you shared some really important resources. There is funding available. There is screening available to cover people without insurance. If there is a need for treatment, there's Medicaid as an option. What else is New York State doing to improve the screening rates?
Yeah, I think maybe a lot of your listeners appreciate numbers like you do. And we have a very robust New York State Cancer Registry. So every case of cancer that's diagnosed in New York State is required to be reported on. So if you have any folks out there that just like data, there's a lot of different ways that it's shown and described, but you can go on the New York State Department of Health cancer web pages, which are also linked in our chat feature, and people can look up, all different kinds of information. So, because data and surveillance is important. If you don't know what the problem is or the extent of it, you can't do something about it. The other things that we do a lot of is general promotion and awareness. So whether it's via social media or opportunities like this, or we have done campaigns in the past to raise awareness and get the word out. Wish we could do more of that over time, and we will seek to do that down the line. We also have worked with a number of clinics around the state, and specifically a lot of federally qualified health centers. Clinics are right at the forefront, primary care, and getting them some assistance so that when patients come in, they've got the right tools in place to get people recommended for screening. I think every adult patient should be asked about symptoms. They should be asked about their risk factors for colorectal cancer. Clinics can put in place reminders for every person to be asked, whether it's by the person checking them in at the front desk, putting them in the room, or the actual provider that's seeing them. And then also, a lot of times providers really appreciate knowing how they're doing. So what we call provider assessment and feedback. So a lot of clinics have implemented ways that the rates of their colorectal cancer for patients is shared with them, and then they can look at ways to improve the numbers of their patients that get the screening that they are due for. So lots of clinics are putting these things in place and we've seen rates trending upward. I think without the pandemic, we were probably closer to budging across that 70% mark, and now we've got a little bit of work to do.
Yeah, and I'm glad that you mentioned healthcare providers, because that was really my last question that you answered so well. The focus of this was really on people and making sure that they were aware how unfortunately common this is and how devastating it can be, to try to do the things that we need to do to prevent those, the good diet, the exercise, et cetera, but to really make sure that you have access to screenings. Obviously, the work that you have done with your colleagues, not only within the health department and in your bureau, but across the state, you mentioned we were at a 35% rate. We're ticked up over 70, and then, COVID obviously has had an impact on that. But the effort to really get primary care docs, obviously, as probably the forefront, to make sure it's on the radar. As I mentioned, my experience was my primary care physician reached out to me. I hope that is a common thing. Mm-hmm. I'm not sure that it is, but to make sure that doctors are providing the type of advice that people need, because there's so many different screenings. There's so many different things as you get older that you need to get evaluated on, so that you have a healthy and well life. So I'm going to leave you with an open-ended question. Okay. Is there anything that I didn't ask, or any message that you want to get out to the folks that are listening either live now or will be in the next couple of weeks on this topic?
I think the biggest message is not to wait. Waiting just delays something being found. I went into preventive medicine because I really felt passionate about the topic of prevention. And I think we tended as people to kind of wait for something to be there to deal with it. And I think if we can just get everybody to talk with their healthcare provider about colorectal cancer in general, whatever age you are, talk about it. And don't hesitate to ask about, when you should start getting screened for colorectal cancer. I mean, getting screened at all is great. And if you're 60 years old, go get screened. If you're 50, go get screened. If you're 45, talk to your doctor about it. You probably should get screened. If you're younger than that, share any symptoms that you're having. Talk about your family history. It's not automatically this switch flips at a certain age, right? I think we just have to talk about these things across the gamut and not be afraid to take advantage of the prevention efforts that are out there. You know, and you mentioned prevention in general, and this is not colorectal cancer at all, but you know, HPV vaccine is something that we talk about in adolescence to help prevent certain types of cancer when kids get older from the human papillomavirus. Again, not really tied to colorectal cancer, but HPV vaccine is another thing that's out there to reduce risk from some cancer types. That can be a conversation for adolescents and young adults.
Yeah, I very much share your prevention message. I mean, we spend as a country a whole lot of time being reactive and not proactive. We spend about 5% of our health dollars on prevention and 95% on treatment. And that seems a little bit backwards, right? And I know that, you know, New York State has done an amazing job to try to change that dynamic, to focus much more on prevention. Everything from, you know, the trail system, which why would that be prevention? Well, it gets people out and walking and breathing fresh air and things like that. And really how important that is, because, you know, that makes the difference. People's lives improve. You spend less money rather than waiting for something really bad to happen and then having bad outcomes and spending tons of money. You know, I can't thank you enough for being here. And I didn't plan on doing this. I was going to make a pitch to everybody, as I always do, on vaccines. And you mentioned the HPV vaccine, and that's not the one I wanted to focus on. But you know, we are like at the end of a marathon. You don't stop running the last mile and give up. You put your head down and you cross the finish line. And to get out of this COVID-19 nightmare that we've all been in is the vaccine. And we have a lot of people who are reluctant to take the vaccine, and I can tell them it's safe and effective. I can look at the CDC, which I've done, to show the efficacy rates. There's been 0 hospitalizations and deaths from those who have taken the vaccine, but I'm not a doctor. You are. Can you just briefly tell the folks who are watching why they need to take this vaccine? Any of the 3 vaccines actually that have been approved.
Right. We have 3 approved vaccines on the market now. The availability of the vaccines is growing. The eligibility for the vaccines is increasing. You know, as of a few days ago, ages 50 and older were eligible. I shared with you earlier, I have a diagnosis of cancer. My first vaccine appointment is actually March 31st. So I'm getting vaccinated. I feel very safe about the vaccine, you know, and it's effective. It's effective from keeping us from getting really sick, from needing to be hospitalized from COVID, and potentially from dying from COVID. So, you know, this is one of those things, like you said, it's the last 2 miles of the marathon, and you're exhausted, you're tired. I've run a half marathon, never did a full one, but a half one. You're very cranky in the last few miles, right? You just want it to be over, right? So I think the message, it is just really clear. Getting vaccinated is the best way to protect yourself from COVID-19. And so I hope that people do take advantage of the vaccine, and you know, even if it's difficult to get an appointment right now, keep trying. And I know your organization, your agency, Greg, has been really helpful in getting populations vaccinated.
Yeah, our group has been great. It's so great to hear that from you, because, you know, who am I, right? I'm a social worker, you're a doctor, but I feel the same way. I have my appointment next Wednesday.
Oh, great.
It was very easy for me to get my appointment through the Am I Eligible website, which I believe Alex is putting in the chat as we speak.
Nice.
And again, I look at the data around the flu vaccine, which is only 60% effective. And we all, you know, the overwhelming majority of people take that and feel good about it. These, the first 2 vaccines, the Moderna and not the Johnson & Johnson, the Pfizer, are 95% effective. You know, I'm going to have no issue going next Wednesday. We will publicize that. I really encourage folks, look, we got to get out of this, and this is the light at the end of the tunnel before all the variants wind up spreading. All those pictures from South Beach in spring break, those folks are on planes coming back to New York and other states around the country. And we're seeing spikes in 27 other states because they're relaxing basic safety protocols and not getting vaccinated. We can't be that dumb. We're so close to the finish line.
Yep.
Can't thank
Absolutely.
you enough, Dr. Dacus, from being here. Again, I want to pitch the COVID-19 checkup. That's also in the checkbox. That's the only national tool that actually assesses your risk based on your daily individual behaviors, where you live, who you see, do you follow the safety protocols that will assess your risk for contracting the virus, spreading, being hospitalized, and dying. Has some additional features as well. It's free and it's anonymous. Please take that. Again, I want to thank Dr. Dacus for being here. I'm sure we will have you back. It's been a pleasure. Certainly my staff for making this another great informational session. We'll be back on April 8th talking with our friend Frank Melia about ways that you can use your home to stay in your home to maximize your independence and longevity in the home and community. So thanks again for joining us. And again, big thanks
Thank you
to
very
Dr.
much.
Dacus.
Take care, everybody. Thank you so much, Greg.